Hello, I am Christine Joy Michelle, student nurse. So, every time we perform, we must review the client's medical record and perform the pain assessment and check the vital signs of the client and assess the client's ability to move and flexibility. And prior for performing the procedure, introduce yourself and verify the client's identity and ask how can you address the client. And before performing, we must close the curtain to provide the client privacy and safety, and we must explain what are we going to do and why it is necessary. And never forget to perform the hand washing techniques before and after the procedure because this will prevent the spread of microorganisms. And always observe the proper body mechanics and prepare the equipment that are we going to use to conserve time and energy. And it is important to remember that in placing the equipment, it should be placed according to which will be used first, and always ask the clients if they are comfortable in that position. Good day, ma'am. How are you feeling po? Do you have any pain, itching, or other symptoms? Will you be able to take part in the breathing process? Okay. May I check if there's any medical devices attaching your body? Okay, may I check your temperature as well po? Allow me to insert this on your axilla. I will be removing na po. Oh, your temperature is 38.7 degrees Celsius, which is a bit high. But don't worry because I will help you and assist you with the doctor instruction. Tepid sponge bath is in which patient body is wiped with wet cloth or sponge that has been soaked in tepid water, and if the TSB is done to lower the body temperature in the presence of fever, the water used for the bath should be lukewarm. The purpose of this procedure is to give a hot bath to clean a specific area of the body. This is also used to lower the patient body temperature and stress. The equipment to be used are washcloth, towel, rubber mat, bath blanket, empty basin, bath thermometer, cold water, hot water, thermometer, and gloves. Because you have a fever, I will give you a tepid sponge bath. It will help to decrease your body temperature. It will be okay for you, ma'am. We'll now cover the patient with bath blanket and remove all the patient gown and top sheet. First is put a cold and hot water into the empty basin. And assuming that this is a bath thermometer, I will use this to see if the temperature of tepid water is enough. After that, apply 4 washcloths into the water. Make sure to squeeze them tightly. Then I will use a rubber sheet and dry towel to keep the patient bed dry. Now we are apply this on the forehead. Ma'am, may I apply this on your forehead? Onto the axilla. Ma'am, may I insert this to your axilla? groin area. Ma'am, may I allow me to insert this on your groin area? I will insert in ito. We must do this process 20 to 30 minutes and we must reapply the washcloth if needed. Following that, I will use a washcloth. We'll squeeze it and fold it into meat. And gently sponging the far side extremity first, beginning with the hand and working your way up to the axilla. Mommy, allow me to sponge your side. And then dry it with the towel I set out a bit ago. And take it off and replace it to the opposite side. And then do the same procedure. Start from the hand up to the axilla. And then dry it. And then we go on to the leg side. Likewise, follow the same procedure. Starting up from the toe, working out your way to the groin area. And then dry it. And then move to the other side. Do the same procedure. Starting from the toe up to the groin area. And then dry it. After that, let's go on to her back and buttocks. Ma'am, I will position you into this and I will lift your left leg so that I may easily turn you towards me. Okay. And then I sponge the patient back using the same technique. We begin with the buttocks and work your way up to the upper back. And then dry it. In count of 1, 2, 3, I turn you towards me po. Okay, 1, 2, 3. Place the rubber mat and towel. Begin with the buttocks up to the upper back. And then dry. Ma'am, in the count of 1, 2, 3, I will return you to your supine position. 1, 2, 3. Now that I almost done with the procedure, I will be removing the washcloth from the forearm, axilla, and groin area. Ma'am, may remove na po. Temperature again. Ma'am, may allow me to insert this? The patient temperature has now decreased to 37.2 degrees Celsius. If required, repeat the process until the patient temperature returns to normal. If the patient suffers from chills or cold as a result of the tepid sponge bath, you will need to lay a hot water bag in the pit area to the patient feel warm. So assume that my patient is feeling cold or having a chills after the tepid sponge bath. So we need to place a hot water bag in the foot area. The purpose of this is to make the patient feel warm and to decrease the temperature of the patient. So this is the equipment to be used. A hot water bag, a bath thermometer, gloves, towel or cloth, thermometer, pitcher, cold water, and hot water. When making a hot water bag, you need to check for any leakage. Turn it upside down. Put a cold water into the pitcher and hot water. Using a bath thermometer, determine the temperature of the water. And then fill the bag halfway to 2/3 with 46 degrees Celsius of hot water. After that, remove the air within the bag and secure the lid tightly. Then remove the excess water from the bag surface. Then after that, cover the bag with any cloth or towel. Don't forget to cover the hot water bag with cloth or towel before placing it to the patient extremities to prevent skin damage or burning. And then put it under the patient feet. So ma'am, I will be putting a hot water bag on your feet and ask whether it's too hot for you or you feel uncomfortable. And then wait for the patient temperature has returned to normal before removing the hot water bag. Ma'am, I will check again your temperature. Is that okay with you? Allow me to insert this on your axilla. I will be removing na po. So ma'am, your temperature has returned to normal and I will stop here po for you to relax. And now I'm going to remove the patient butt blanket and place it with a clean sheet. I will be removing your butt blanket. So ma'am, I will be leaving you na po and I hope you feel better now that I have done the procedure. I check again you later. Goodbye.